I'm Dr. Chris Landon. I'm a pediatric pulmonologist. I have interest both in adult pulmonology and COPD as well as pediatric pulmonology. We also do medical care overseas and in Honduras, Chad, Monrovia. What we've found in foreign countries is that the availability of ventilators is a problem, the lack of electricity is a problem, and I've spent literally hours bagging with an ambibag patients after over excessive anesthesia. What we've developed is a readily manufacturable ventilator with materials and parts available with a 5-day lead time. The product is assembled and tested at FDA certified facility. It accommodates standard hoses and fittings, a respiratory rate of 10 to 30 beats per minute, a tidal volume of 300 to 800 ml, and the ability to measure and control peak inspiratory pressure, adjustable inspiratory to expiratory time ratio, ability to support triggered breaths. It provides positive end expiratory pressure, is able to use ambient or low pressure oxygen, is able to operate off generator power sources, able to trigger alarms for key critical parameters, and there's an onboard data log to act as a black box to record usage data. Our team consists of myself. I have years of experience in advanced biomedical engineering devices, bringing them to market. John Stump is our mechanical engineer, again, a medical device expert. Chad Yonker is providing our financial expertise. He has over 28 years of experience. Shep Bentley provides a very important role of FDA regulatory expert. And Mike Pollock, electrical and systems engineer, medical device expert. And the sensors you see on this